that UKR is a motion-guided implant, while TKR is implant-guided motion. This is the basic difference we have to understand. So everything is intact, the implant must glide as the knee glides. Soft tissues are normal, already repeated many times. There are 5 ligaments, we have to evolve to 5 ligaments when we talk about uni. In TKR, we talk about 4 ligaments. Gaps are always flexible and they are stable, and avoid stretching of soft tissues to avoid overcorrection. Sorry. So what is the loss in a knee? It's a volumetric loss of solid content in a medial compartment. It has to be refilled with a loss with a wear-resistant surfaces, and that has to be done with the congruence. Do not cut much or much damage the strong tibial platform, and prepare good bed for the fixation of the implant with a cement. Keep harmony between the components. Since we are witnessing this since 3 days, this is absolute need in fixed bearing design, and uni has entire plane as a functional plane. In TKR we talk about the joint line. It's never a line, it's a plane we are talking and we are evolving to understand with robotics. So at least finally we should agree, Dr. Narendra Vaidya had recently emphasized that MCL is a mother, mother should be with a father, so deep MCL is a father, which we completely remove in TKR. In uni, it has to be preserved, so deep MCL is present in a knee. Let us acknowledge it as important knee ligament, it does exist. And stability evaluation in uni, what we are evaluating in stability, it has to be a stable joint. Otherwise, we are contradicting our own statement of selecting a right patient. So when the soft tissue sleeve is normal, flexible and stable, it doesn't require much evaluation preoperatively. All you need is to fill this with a precise implant. So unaltered soft tissue rules out mid-flexion instability. There is nothing like mid-flexion instability in uni. The static part is bone. We cannot ignore that in uni as well. The bone is the hardest tissue of the human body, and technology in the woodwork is unbiased. When we talk about the wood, we are very happy with the millers and everything because it can serve the very fantastic design. So we must appreciate this in robotics as well, in human knee. Shape, size and orientation varies in femur. So we have to take into consideration before we enter into the surgery, and the slope we try to reproduce by preoperative imaging. Mechanical alignment is gold standard in uni, as well as of the limb, as well as of the internal component alignment. So that what we had already witnessed, you can have everything before you go in. See, it is just like having your book flight. So you don't want to move here and there on table and struggling. I think this is one of the finest way. You plan everything before you get scrubbed. And the dynamic part, which is already healthy soft tissues. In TKR, it may vary, the concept may vary, you change your protocols. Here you don't need to change anything. Just keep them healthy after your bone cuts. Planning and execution both needs attention in unicompartmental knee replacement, and the most assured technology is the answer. I think this sums up my talk that you need not only the mind with artificial intelligence, you need an arm to execute your plan. So you definitely need Jai and Viru rather than living with the armless robot. And thank you, Active Robot, and already you had witnessed the surgery. Thank you.